Let's switch to our next topic here on Sports Medicine Weekly. Prehab to prevent injury. Dr. Cole, it's all about being proactive, not reactive, right? You see this, and whether it's to prevent injury or maybe someone has suffered an ACL injury and before you go to surgery, right? You get into this?
That's right. It's interesting. When you tear your ACL, it's not necessarily particularly painful, or if it is, it goes away quickly. But when they come in, it's a pretty similar story each time. They have trouble straightening their knee because the hamstrings go into spasm. The knee can be particularly swollen. Quads are completely shut down because all it takes is about 10 cc's of fluid in your knee and your quads will shut down. So if we're going to recommend surgery, they have to come in feeling like they never even had the injury. They just have to have a loose knee, which they wouldn't otherwise be testing. So their knee should feel very normal. So we introduced this concept of prehab or prehabilitation, which the therapists are quite good at. And it's really, I think, a requirement prior to surgery. In fact, there's even some literature for patients who want to go knee replacement surgery that prehab is a good thing to do in terms of optimizing the postoperative outcome.
You know, out in Los Angeles, there is a company called the Prehab Guys. We're going to bring on the director of the co-founder of the Prehab Guys, joining us from Los Angeles, California. Waking up early on this Saturday morning, it's Arash Maghsoodi from the Prehab Guys. Arash, how are you?
Good. Thanks for having me.
Good. So you are a physical therapist, co-founder of the online educational platform, The Prehab Guys, and I want to understand you teach people how to take control of their own health through online physical therapy. So start me off with your definition of what is prehab.
Great. Yeah, so Dr. Cole explained it very well in terms of the surgical side of things. And I think that it's very important as we see outcomes post-surgical seem better if a patient does go through some prehabilitation preoperatively. But our goal is to, in addition to help with educating preoperatively, help people reduce risk of injury in the first place. As you mentioned, being reactive is the way that our society is. People are looking for the quick fix after they already have the issue, and that's when they see Dr. Cole and I in the clinic. However, our goal is to really educate the public on ways to mitigate risk of the injury in the first place, essentially being proactive. And so it's kind of like taking care of your physical hygiene. We all know how important it is to take care of your oral hygiene with making sure that you brush every day, floss every day. However, I think that the common knowledge is not fully there in terms of making sure that you're proactive with your physical health in terms of moving every day. So I think that's the big idea we're trying to do, is educate people on how to reduce risk of the injury in the first place and giving them actionable items that they can do.
How much, it's interesting. Patients will need therapy often in the early phases after surgery. So, the way I tend to use prehab is I'll say, look, a couple of times a week, mainly because they don't always have unlimited insurance benefits. And two, we're just trying to space it out a bit because they can go to therapy all the time. I mean, do you have any rough guidelines in terms of the frequency in terms of, let's just use an ACL as an example?
That's a great question. So the issue, like you mentioned, is insurance reimbursement, which is really a difficulty. Sometimes I'm only really given one visit preoperatively. And so what I do more so than test and assess them to depth, I just focus on making sure I educate someone on how to keep moving and maybe give them some micro progressions up until that surgical date. Ideally, if we can see someone once a week, I think I can get a good idea of how I can manage their load throughout the week. So it's more than just the specific exercises. It's more a matter of making sure that they understand how much they should be moving and making sure we slowly progress them so that way they're at a good spot when surgical date hits.
Visiting with Arash Maghsoodi. He is the doctor of physical therapy, co-founder of the Prehab Guys out of L.A., Los Angeles, California. How can your exercise database, Arash, help individuals take care of their physical health?
Yeah, so on our website, we have a few things that we actually recently relaunched. One is a full body map that will give people an idea of what to do for every specific body part. So you see this map and you click on a body part and boom, there's articles, there's exercises and educational tips on each body part, which is great for educating people. But I think the exercise library that you're talking about actually has a very comprehensive database where we've created tags and search options. So if you click on a specific diagnosis or a specific body part, you'll populate a bunch of different exercises that are appropriate for that tag. For example, that ACL reconstruction or ACL sprain or rotator cuff tendinopathy, all these issues. Or you can just search body part and find a bunch of different exercises. So that way you know how to perform the exercise appropriately. I think the big thing is that a lot of people may know what exercises to do, but they don't exactly know how to execute it. And while there's not necessarily a bad exercise, we want to make sure that the intent of the exercise is being met, which is why this database allows people to search any exercise and make sure that they know how to perform it, where they should be feeling it, and common compensations.
Good stuff. The website is theprehabguys.com. You know, I had a shoulder surgery done by my co-host sitting next to me about 14 weeks ago or so. Dr. Brian Cole and I had a tenodesis. Have you heard of that, Arash?
Of course, yeah. Bicep tenodesis, yeah.
Yeah, I'm doing real well. I can't wait to play golf. Doc says a couple more weeks. He wants to give it a full 16 before the full swing, but no, I'm happy I had it done, and it's getting better every day. But I'm going to go to your website and check out some other exercise because I'm almost done with my my PT, and it's a great source to go check it out. So I'm gonna do that, and I'm gonna go check out your website. All right?
Absolutely, yeah. You're in good hands.
Good stuff. Hey, Arash, thanks so much for joining us here on Sports Medicine Weekly.
Yeah, thank you for having me on.
Appreciate it. Arash Maghsoodi from the Prehab Guys. Again, the website, theprehabguys.com. When we come back, it's our staple of the show. It's our Ask the Doctor segment, giving you a chance to ask Dr. Cole your questions about sports medicine. Stay with us. You're listening to Sports Medicine Weekly, only on
670 The Score.